taking medication to help your brain get back on track should not be a shameful thing. And we don't think enough about how is the illness impacting our own health and the health of our baby.
Hey friends, Alexis here again with a little intro for you. If you are pregnant, postpartum, thinking about getting pregnant, or just trying to survive the fourth trimester, this episode is for you. Today, HeHe is joined by reproductive psychiatrist Dr. Kristin Lasseter, and they are diving into one of the most important and most misunderstood conversations in motherhood: mental health medications during pregnancy and postpartum. In this episode, they are talking about postpartum anxiety versus postpartum depression, what's actually normal baby blues and what's a red flag, intrusive thoughts, medication stigma, how those medications impact breastfeeding, hormone crashes after delivery, and how to weigh the risks of medication against the very real risks of untreated mental illness. So if you have ever wondered or even heard from a well-meaning healthcare professional or friend, should I stop my meds? Is this anxiety normal? Will this hurt my baby? Why do I feel so ashamed? Then this is your evidence-based, zero shame, deeply compassionate episode. You do not have to white knuckle motherhood, pregnancy, this preconception area. And you absolutely do not have to choose between being and feeling well and being a good mom. Let's get into it.
Dr. Lasseter, welcome to the show.
Hi.
I'm so excited to have you on, even though this is a topic that I think a lot of times we maybe lean away from if we are not like in it, like really, really in the trenches with it, right? Because it's a hard conversation. It requires a lot of self-reflection. And if you are coming to this conversation having already had an experience with postpartum anxiety or depression, it can feel really triggering and scary. And a lot of times, mental health in general, never mind in womanhood and motherhood, come with big feelings like guilt and shame and embarrassment and even feelings of failure, even though that we know mental health is a normal part of the human experience, very normal part of human life. And so I think that's why I'm really excited. Leave it to me to crack open the things that nobody else wants to talk about. I'll definitely talk about it. And I just want to provide people with a space to feel safe in having these conversations. And you don't have to be the one to ask the hard questions. I will ask. And now you are equipped for conversations to take back to your provider to say, like, hey, I think I'm experiencing this, or I think in my past pregnancy or postpartum, I experienced this. And now going forward with this birth into this postpartum, I'd like to talk about it beforehand. And so that's the goal with this episode. So I think a good place for us to start is maybe defining PPA versus PPD, because a lot of people maybe use them interchangeably and there is a lot of overlap, but they are essentially different when we're looking at diagnostic criteria.
That's right. They're very different. So, PPA or postpartum anxiety is a little less common in some research studies than postpartum depression, but it's also kind of like the stepsister of postpartum depression. And then it's really been neglected in research around perinatal mental health. So, we don't have as much information. So, maybe it is more common, but essentially, postpartum anxiety is when somebody is struggling with a lot of feelings of nervousness, feeling anxious. They have a hard time usually relaxing and just being able to enjoy the moment with their baby. A lot of times their worries are around the health of their baby, the safety of their baby. They can have trouble with sleeping because they're so wound up and worried. And for a lot of people, it's also these like intrusive, really scary and disturbing images or thoughts of bad things happening to their baby. And sometimes it can even be disturbing images of them doing something bad to their baby, which causes a lot of avoidance just in general, trying to avoid baby being hurt or, keeping baby healthy. All of those things is kind of wrapped up in postpartum anxiety. And then with postpartum depression, it's more of, feeling down and sad and those kinds of things.
So, how can we tell the difference between those expected hormonal shifts? Because after you have a baby, you're not gonna like push out a baby and then automatically be like, "Whoa, let's party," right? So there's this period of time where it is, dare I say, normal, expected, common that you are feeling a little run down mentally. You might be a little weepy. You, especially as a first time parent, it depending like truly depending on how much you've been around babies in your life. If this is the first baby you've ever been around, of course you don't know what normal baby behavior is like. And to no fault of your own, it's just like a brand new experience. How are we supposed to tell, and especially the people around us, how do we tell the difference between like what's normal versus, okay, I should be talking to some sort of provider, whether that be a social worker or my OBGYN or my midwife or my mental health counselor about the things that I'm feeling?
That's a great question. And I feel like so many people struggle with deciding how to know, like, what I'm going through, is that normal or
Yeah.
not? And I would say, even in my own experience, being a psychiatric physician, I had trouble discerning what exactly is normal versus what is should I be concerned about. And I think it's hard to know for yourself in the moment, but a good kind of gauge is time.
Okay.
So, similar to whenever there's any huge change, we always need some time to adjust to that big change. And usually that's about 2 weeks or so for most people. There's a big change that happens. We, might have changes in our sleep because of it, might feel different with our mood or stress. And same with having a baby. In those first 2 weeks, there's kind of this adjustment of shock of, a change in life. Now you have a new responsibility. Your sleep schedule is totally different. What you're doing day to day is different. You don't have a routine anymore. And all of that can play into feeling very different from your normal self. But it adjusts. So you adjust over those couple of weeks where, okay, now I'm feeling like I kind of get the hang of what I'm supposed to be doing, or I can kind of, sleep when the baby sleeps, as people say, or have this weird schedule. But if it's feeling like things are not getting better after those 2 weeks, then that might be a flag that something isn't right, because it should be like a normal adjustment for most people. Add in, though, the hormone part of it, and that can make just mood a lot more of a component than it might normally be for any other adjustment. And so if you notice big things in your mood, like feeling sad all the time, or feeling anxious all the time, or, not being able to sleep at all, those things aren't normal. Or, having thoughts of death, which is a common red flag of, you shouldn't be thinking about like, oh, this is so hard, I don't even want to go on, or people would be better off without me. Those things are more of a red flag of it being a disorder rather than just this normal adjustment.
Yeah, wow, that's so scary for any listener out there who has experienced that, or maybe like you're currently going through that. I just want to say, like, we love you. We want you to be around. Like, we're definitely not better off without you. And, there are people out there that are happy to help you. I think a big one you touched on is like, we really, especially as women and moms, it's sometimes so hard to ask for help, and you don't want the judgment of people thinking like, oh, well, she can't do this. Or like, maybe she really wasn't meant to be a mom. Maybe this is too hard for her. Can you speak to that a little bit about maybe navigating those thoughts if someone is having really intrusive thoughts, but then they immediately follow it up with like, oh, but I'm not going to tell anybody because I don't want the people in my life to think that I'm not a good mom, which obviously, you guys, that does not mean that. It's hormonal based. This is not your true brain, your rational brain speaking to you.
Yeah, that's hard because it also depends who's involved in the person's life. It is completely possible that they are surrounded by people who might be invalidating or who might not understand what they're going through. And so I would say I highly encourage people to let somebody know because a lot of times our brain can play tricks on us in terms of thinking, like, especially if we have depression or anxiety, our brain is telling us we're not good enough or it's our fault or, whatever other lies the disorder tells us. So it's important to tell someone, but making sure you feel safe with that person is also important because you can tell somebody something vulnerable and it be the wrong person and they make you feel worse or they make you maybe believe the thoughts that are going on. And so that's why I think talking with a professional or someone who is very experienced in perinatal mental health or just perinatal, experiences in general is important because they're going to be able to help you delineate, what is true versus what's not, and whether or not you're actually experiencing postpartum depression and anxiety.
Now, let's say someone didn't have a mental health counselor going into postpartum, and maybe for whatever reason, they are not able to access one kind of financially or because of family dynamics or whatever it might be. Are there free resources that we can go to? And is this something that all hospitals and clinics offer? So, like, if you go to your OBGYN, they should be able to connect you with someone that can support you. Or are there things that we need to know in order to get support, especially in a country that, access is a little limited in a lot of ways, especially in women's health?
Yeah, I was going to say that I think it probably depends on where the person is because it might be that their OB-GYN also isn't, knowledgeable about resources for mental health in particular. And I would say there is a great organization called Postpartum Support International that can really provide a lot of support in that perinatal time and answer a lot of questions around mental health. And they can set people up with other, providers who specialize in that area, or they just have support people in general that somebody can talk to and kind of get guidance on where should they even start with what's going on. And then there's also the maternal mental health suicide hotline that people can call as well.
Okay. Wow, that's really good to know. We will link both of those things in the show notes, you guys. And then, as a doula, I have to kind of like toot the doula horn. You can always contact local doulas in your area and ask them if there are any local resources that could help you. Again, what you said, Dr. Kristen, is like a lot of it depends on where you are located. So if you're in a bigger city, you're going to have more access. If you're in rural Mississippi, where I grew up, access is going to be a little bit more limited, unfortunately. And I'd be remiss if I didn't bring up the fact that so much of our country is a healthcare desert right now, currently. So I'm glad that we have things like PSI and the suicide hotline. Okay, so in terms of hormones, I'm particularly interested in the idea of existing hormone. Conditions or complications. So, what came to my mind when you said that? I'll just kind of lay it out there for you. Are people with, let's say, estrogen dominance or PCOS, or maybe they needed like reproductive assistance to get pregnant, are those people at more risk for postpartum mood complications because they came into pregnancy and postpartum with an existing hormonal imbalance or complexity of some sort? Is that a logical line of thinking, or we're not really seeing that in the data?
Well, there's just not a lot of research around women's mental health in general. So I think it is a logical line of thinking. But what we've seen so far is that if somebody has any kind of complication during their pregnancy or surrounding getting pregnant, that increases their risk of having depression or anxiety during or after the pregnancy. So even if it's trouble getting pregnant or during the pregnancy they have anemia or they have, a struggle with the birth and delivery, that can increase their risk of having postpartum depression and anxiety. But to follow your line of thinking with the hormones, we don't really have any research showing us that like PCOS or other kind of hormone issues then lead to perinatal mental health issues other than PMDD or people who are suffering from like premenstrual mental health disorders or sensitive to those premenstrual hormone changes. Those people then are also at increased risk of having postpartum mental health changes.
That is so interesting. I feel like that is a topic that has just recently gotten a ton of light. Women are like being diagnosed more often, and they're being open and kind of transparent about their walk with PMDD online. You've got a lot of, influencers or content creators that have large followings that have been really transparent about like, I got diagnosed with this. This is what I was experiencing. And I thought it was normal for so many years because this was just my life before and after my period. And it's really comforting for me to see like this open conversation because, like you say, like so much stuff has been not researched. I don't want to say like ignored, but like, is it? And go figure that
Pretty
women's
much.
health. Yeah, like go figure that we're the ones that don't have the research. That's so, so interesting. Okay. We've talked about postpartum mood complications on the show before. This is not a new topic, but what I wanted to have you on specifically for is to talk about medications because it gets a bad rap and there's so much misinformation out there. We live in a world where people are starting to like really wake up to pharmaceuticals, and very valid, but I do think that we are at the risk of the pendulum swinging way too far, where then nobody wants any pharmaceuticals. And it's like, that's not the goal, right? The goal is to have a society that's not over medicated, but we're also not under medicated. We are using pharmaceuticals and medications appropriately when it's appropriate and in line with your personal goals. So, what I hear so often is, well, I don't want to be on medicine forever. And one of my things is like, it doesn't have to be forever. Let's get you back to a stable place where you're happy. You're being able to enjoy your family. You're being able to serve yourself and your family to 100%. And then you can talk to your provider about switching medications, about, tapering off, about lowering your dose. And you've got so many options. And I think for so long, people thought that a medication was like a one and done. Once I'm on it forever. It is at that dose. That has to be the medication I'm on forever. And it doesn't have to be that way. So, I don't have a specific question about this. I'm going to just throw it back to you and you tell us what we need to know in general, overall, about using medications to help us cope in motherhood. Specifically, let's start in that specific postpartum period and then we can kind of work our way out.
Yeah, I have so many thoughts on this, of
Perfect. Dump
course.
them on us.
First, I want to start with this idea that I think mental health and mental illness just has a lot more stigma around it. And so taking medications in general, yes, like there's a lot of backlash around the pharmaceutical industry and in some cases definitely rightly so. And for some reason mental illness is even worse. It's like just this idea of taking medication for your brain and mood is somehow, I think, even more shameful than doing it for other disorders. Like if you have a heart disease, it's kind of like, well, of course you're going to take medication because it's your heart. You can't help that. Like your heart and your liver and any other organ in your body, your brain is literally an organ in your body and can go under issues where it can't function like it normally does. And that's not in our control. Sometimes, yes, can we eat healthier and exercise more or do things with our lifestyle to help our body? Yes, but that's not necessarily going to completely prevent or control any specific illness. And same with mental illness. So we can do all the right things, and still sometimes our brain just doesn't function like it's supposed to. And when we're talking about the postpartum time, the hormones estrogen and progesterone, which get to their highest that they ever are in our lifetime in pregnancy, those plummet postpartum because the placenta comes out, which is making all the estrogen and progesterone during pregnancy, and everything else has kind of been shut down while the placenta has been making it. And so when the placenta comes out, those hormones drop. And our brain has receptors for estrogen and progesterone's metabolites. And so when these hormones plummet, it causes changes in our brain. And that's normal. It's normal to have like the baby blues or have kind of this emotional up and down around the postpartum time. But in a brain that's predisposed to having mental illness or not being able to function as well, that's a time when it becomes really vulnerable with these hormone changes because it can't adapt as well as maybe a healthy brain can, or a brain that is more stable with regards to how it's functioning. And so, taking medication to help your brain get back on track should not be a shameful thing. And we don't think enough about how is the illness impacting our own health and the health of our baby.
Mm.
So in pregnancy, especially, we have a lot of research showing that mental illness has negative effects on the baby and on the health of the pregnancy. And same with postpartum in terms of our baby's development. They are developing rapidly in that first year, and their brain is developing rapidly. And a lot of that is based on what they're seeing and interacting with mom. And so, if mom or dad or another parent is not in their best state in terms of mental health, that's going to affect how the baby is developing too. So we have to balance this risk of taking medication with this risk of mental illness. And same goes with supplements. You know, there's supplements that can also be harmful, and there's medications that can be harmful. And in an ideal world, we don't have to take anything and we can just be natural and healthy. But if we're combating the risk of mental illness or some other illness, we have to weigh the risk of that with the risks of the medications or supplements or whatever other treatment we're thinking about for that disorder.
I mean, if you find that ideal world, please let me know. I'll move there
Me too.
tomorrow, right? Like, who is she? Where does she live? Where is she? How can we get to her? That unfortunately is just not the world that we live in, right? Like just with general stress in life, oxidative stress in life, the world that we live in, all the things that are going on, the way that we live in a country that honestly doesn't really support women and family and the growth of families. We have no maternity leave. We have no paternity leave. Like you're genuinely lucky if you work at a company or have the availability to have maternity and paternity leave. I could just go on and on and on about the stressors that parents are under. And so it's to no surprise to me that we have such a mental health crisis in our country. So, one thing that I continue to hear in pregnancy is I'm on mental health meds of some sort, anti anxiety, antidepressant. I got pregnant. My doctor told me I should stop them immediately. My heart sinks because I'm like, oh my God, that is so dangerous and terrible advice. And I'm very scared that your OBGYN gave you that advice. But who am I? I'm just a doula. So you Please explain to us, share with us what we need to know. Now, there are some medications that aren't safe in pregnancy, so there might need to be a little switcheroo in medications, but stopping cold turkey is generally not recommended. And then it kind of goes back to the conversation of if we pull you off your mental health meds, what are the risks of that compared to the risk of staying on the med? So let's dive into that for someone who is trying to navigate this decision and they're newly pregnant.
Yeah, like you said, there are some rare cases where you do want to stop the medication immediately. And that can be, discussed with your doctor. But I think the way to understand, does my doctor really know? Are they really giving me the best advice in terms of whether or not I'm supposed to stop this psychiatric medication? Is asking them to explain to you what are the risks of these medications? What are the risks of me stopping it suddenly? And really delving into whether or not that sounds like the right thing to do for you. And basically, the risks of just suddenly stopping psychiatric medications is your brain has been adjusting to having this medication, and when you suddenly stop it, you're plummeting it back into what it was before without slowly getting it there. So when we taper psychiatric medications, a lot of times we can see the benefits of them continue even after they're gone. But if you just suddenly stop it, you're going to disrupt all of that work then it's done and kind of rip it apart. And then a lot of times people notice they'll have withdrawal effects from the medication, they'll have anxiety come back or depression come back, and it's miserable. And that in itself can be dangerous for a pregnancy.
Totally. Okay, you mentioned the rare cases, just like in general. Obviously, you're a doctor, but you're not our doctor. But what are some of those rare cases where someone might be looking at a situation where we should stop our medication?
So one of those rare cases is if someone's on valproic acid or valproate. And I usually, when I'm, giving talks about medications in pregnancy, I encourage people not to even give that medication to women who could get pregnant because it can be very dangerous in pregnancy. But for some people, maybe they've tried everything else and that's the only medication that has worked for them. Then it's kind of this weighing again the risks and benefits of if I stop this medication, what risks can come back and weighing that against the risks of, what are the risks of these medications in pregnancy. But that's one that commonly can be a more dangerous medication to take in pregnancy.
Are there others? What other kind of medications might be a little iffy in pregnancy? Or for the most part, are they all pretty much safe in pregnancy?
I wouldn't say they're all safe. I would say for a lot of medications, for the majority of our psychiatric medications, their risks are not as big and as dangerous as the risks of the mental illness coming back. So for most of the psychiatric medications, we wouldn't recommend switching or stopping them in most cases. If somebody has some other, medical disorder that is, being made worse by the medication, and that in itself is life-threatening, there's cases where it might be appropriate. But if somebody's doing health, they're healthy, they're doing well, we generally, for most people, don't recommend stopping or switching their medication, especially once they've already become pregnant.
Could it be the case that you are looking at lowering the dose, though?
So, in many cases, the dose doesn't correlate with the risk.
Oh,
There are
okay.
some medications where it does. So, like lithium, for example, the dose in the first trimester might correlate with the risk of having a heart defect. And so, in that case, we might want to lower it for the first trimester. But in a lot of cases, there's no evidence saying, okay, if we go on a lower dose, that will protect against whatever risk. And we know that going on a lower dose increases the risk of mental illness coming back. And so there's also the argument of, do you want to be on a lower dose and have the risk of the medication, but then also have mental illness symptoms coming back? Then you have the risk of the mental illness, and now baby's getting two risks when it's not getting any benefit.
Got it. Okay. And in terms of risk, what other things should we be aware of? And this isn't to say like you're going to experience this, but just to have a transparent conversation about like these are things that you need to know. Are we seeing it associated with respiratory distress at birth or fetal growth restriction or anything like that?
With the medications,
Yeah, and just like in general, not anything specific. Like no specific medication, but like what kind of risk should people be at least aware of and maybe asking their provider, does this medication have any correlation association with X, Y, and Z?
yeah, so the big things that we kind of look at are birth defects. Is this
Okay.
medication going to increase the risk of birth defects? Is this medication going to increase the risk of developmental disorders? Or is it going to cause growth restriction or cause withdrawal symptoms in the baby after birth? Or another thing is what we call neonatal adaptation syndrome, where the baby has a difficulty adapting to being born because of maybe exposure of the medication. And so those are important things to look at and weigh in compared to the illness.
And do you recommend anyone that goes on medication in pregnancy? Well, I guess that's a good question that we should ask. If mental health problems pop up during pregnancy, is it appropriate to start a medication in pregnancy if we didn't get pregnant while we were on it?
100%. And it all depends on the severity of the mental illness, but after it reaches a certain point of severity, it is more dangerous to not treat the illness and not get on medication than it is to treat the illness and be on medication. So for a lot of people, they do start medication in pregnancy, and having depression or anxiety or another mental illness episode start in pregnancy or recur, come back in pregnancy, that is one of the greatest risks for having postpartum depression or postpartum anxiety.
Wow. Okay. And are we thinking that some signs and symptoms of those things, ranging from kind of low intensity all the way to the worst case scenario is like, you're feeling really sad and down. Maybe you stop nourishing yourself. Maybe you stop sleeping, all the way to like really intrusive, dangerous thoughts, all the way to the worst is, obviously maternal suicide.
Yeah, absolutely. And, if it is more mild, and that's something, going to a psychiatrist and getting evaluated for some people, if it is more mild, being able to just do therapy might be enough. But for some people, yeah, I mean, their mental illness, it not only impacts how we behave, so how we're taking care of ourselves and how we're interacting with other people, but it also affects what's going on inside of our body when we're under that kind of stress with our brain, that affects the health of the rest of our body too.
Like hormonally, so it may impact your pregnancy.
Yeah, absolutely.
Tell us about that. Dive more into that. What do we need to know about the way that our brain is kind of connected to our hormone health?
So there are theories. There's nothing, proven in research yet about this, but one of the theories is that when somebody is going through a mental illness, their brain, the way that it's adjusting cortisol in our body is different from how it would be doing it if we weren't struggling with mental illness. And cortisol in pregnancy is really important because that is what is helping with the baby's development, their growth, a lot of what, the placenta's function and the baby's brain development. And so if our cortisol levels aren't doing what they're supposed to be doing and fluctuating the way they're supposed to be fluctuating, that can have effects on the baby's growth. So we see fetal growth restriction a lot of times associated with mental illness. We also see people going into preterm labor and having early delivery, which is can be very risky for the baby and for their lifelong struggles. And then we also see that the baby's brain can be developed differently when a parent has mental illness versus a baby who's born to a parent who didn't have mental illness. And what we see, what some studies have shown is particularly the amygdala or the part of our brain that controls a lot of our emotional reactions is different in babies who have been exposed to mental illness in pregnancy versus babies who have not.
Wow, that is so interesting. Now, this is something I could really geek out on. Something that dropped into my brain as you were talking is the intersection of fetal growth restriction and looking into, is it really the medications are associated with maybe an increased risk of fetal growth restriction, or is it the cortisol levels? And how do we find that super balance of getting someone properly medicated at, the lowest dose possible, the maximum benefits, but also controlling their cortisol levels? I mean, my brain just exploded with that. That's a really wild thought, and I'm not sure how you would study that.
Yeah, that's kind of been the dilemma with a lot of research around medications in pregnancy for mental health because we'll see studies come out saying antidepressants are linked with autism, or antidepressants are linked with fetal growth restriction, or they increase the risk of postpartum hemorrhage. And then if you go look at the other research about mental illness, you see those same things are increased with mental illness. And so then the question becomes, well, is it actually the mental illness that's increasing the risk? And it's just that the medication's not taking away that risk? Or is it that the medication is adding its own separate risk? And lately, they've been able to do some really cool statistics with data on being able to parse out controlling for the mental illness and what risk that's bringing to the table versus the medication and being able to parse out, okay, it looks like there's an increased risk with the mental illness, but when we're accounting for the mental illness, we don't see an additional increased risk from the medication.
Got it. Okay. Really interesting. Do you ever see a world where we're like fully investigating women's health and especially mental health? Do you think this is like a lifelong thing we're just going to have to always be advocating for until we're blue in the face?
I mean, I think it will happen. I'm having hope.
You're much like me. You're like a see the glass half full type gal. I am too. I
Yeah.
mean, I fully recognize the state of our healthcare. I really do get it. I understand our country is really struggling right now. I do think that eventually we will figure all these things out and we will be a better country for it and we'll have a really fruitful healthcare system. I truly am hopeful for that because I think there's a lot of people out there who do recognize the problems that we're facing. And while we might not have the answer right now, I think a lot of us are working towards an answer. And the more of us that work together to find that answer, the better off that we will all be.
With science, it's a team effort. So it's not even just what our country's doing, it's what other researchers are doing in other countries too. And luckily, other countries are still invested in learning about these things. And so I have hope that it won't die.
What do we see in other countries? Are we seeing better mental health in other countries in moms in pregnancy and postpartum? Is it kind of the same? Are they worse? What do they recommend for medications in pregnancy and postpartum?
So the recommendations are typically the same as what the experts here recommend. So there's a lot of experts throughout the world that kind of do a lot of the same research and have the same kind of theories and hypotheses around medications and pregnancy. And so what we end up seeing is that the recommendations generally stay the same from country to country with the experts in perinatal mental health.
The one thing other countries do much better than we do, though, is that support piece, right?
Yes,
So they've
absolutely.
got those home nurses that come and visit, they have their midwives. We've had a number of births outside of the US, and I love it because it exposes our team to what it could be here in the US, but simultaneously, I feel so sad for American families because it shows me how good it could be here, and it's just not. And so I do dream of a day where we have this really comprehensive support for growing families, and you don't have to leave your house for X, Y, and Z appointments all in the first week because those practitioners are coming to you. And maybe postpartum support, whether that be a doula or a midwife or whatever it might be, is subsidized, and it's paid for by your tax dollars, and you get that money back to help support yourself in postpartum, which is a really tough time. And we have a world where, or a country where, you get adequate paid maternity leave, not just access to time off, but you have to figure out the finances. But genuinely, you're paid to take care of your family and yourself and rest and heal after birth.
We're always talking about the big things in pregnancy and postpartum, the birth plan, the feeding plan, the sleep plan. But today I want to tell you about something small that made a huge difference in my pregnancy and my postpartum. Because when you're living a life that's based around a baby, your days are totally full. I'm talking about Cozy Earth's essential socks. Visit cozyearth.com and use code HeHe for 20% off your purchase. Now, if you follow along on my Instagram, you already know I absolutely live in their jammies and their comfort wear, but their socks have made such a big difference for me. They're small, grounding comfort designed for everyday life. They're soft, they're breathable, and they're thoughtfully cushioned to support you from your very first step to your last, right before your head hits that pillow. Whether I'm moving through my morning routine, tidying the house during nap time, or scrambling around the kitchen trying to fill the bottle washer while making dinner, they just feel good. And I think what I love the most, and I own all of them, so I can speak to this, is that they come in 4 versatile styles: calf, quarter, ankle, and no-show. So they fit seamlessly into whatever you are wearing, wherever you're going, whether you're in sneakers or slippers, or really you're just trying to achieve that barefoot but not really vibes. Cozy Earth nails it. They're an everyday essential where quiet comfort meets intentional design. And when it comes to intentionality, again, if you've been following me, you know that over the last few years, I have been trying to rid our home of toxic materials like synthetic things and polyester. So a few years ago, really invested in bedding. Cozy Earth has the best bedding. And if you're going to spend your nights feeding and resting and healing from birth, or just simply trying to get deeper sleep, you're going to want luxury. I'm talking about their sheets and their comforters. Whether you are on the go all day or you're finally home for the slow moments at night, Cozy Earth's bamboo bedding is breathable, temperature regulating, and unbelievably soft. It elevates daily life in the most practical ways, from sleep to slow moments at home. Cozy Earth essentials are thoughtfully crafted to make the ordinary feel, well, extraordinary, because motherhood is built different and you deserve comfort. Visit cozyearth.com and use my code HeHe, that's HEHE, cozyearth.com, use code HeHe for 20% off your purchase. And let me ask a little favor. If you get a post-purchase survey, please be sure to mention that you heard Cozy Earth right here on the Birth Lounge podcast. Again, visit cozyearth.com, use my code HeHe, HEHE, to save 20% off on your purchase. Experience the craft behind the comfort and make motherhood feel intentional.
Speaking of that postpartum period, a lot of people have questions, especially if you are thinking to introduce medications in postpartum, about breastfeeding and medications. So, what do we need to know about that? I think the main concern is obviously, if I take this medication, A, can I keep breastfeeding? And B, does this medication come through my breast milk and get to my baby?
A lot of medications, I would say most medications get through the breast milk and go to baby.
Okay.
But breast milk kind of serves as a filter in that the amount that's getting to baby is usually a fraction of what is in mom's bloodstream. And so again, it comes down to weighing the risks and the benefits. So what are the benefits of continuing to breastfeed or baby getting breast milk if possible versus what are the risks of the medication being in the breast milk? What are the risks of the mom saying, well, I rather breastfeed and I'm not going to take the medication. I'm just going to continue to suffer with this illness. So, weighing all of that, and usually when we're talking about the majority of psychiatric medications, they are compatible with breastfeeding. So, it's not that there's no risk at all or there's nothing we need to worry about, but it's that the benefits of continuing to breastfeed and the benefits of the mom taking the medication outweigh those risks that might happen with the baby being exposed to the medication in breastfeeding. And I think a good rule of thumb for that is also talking with the pediatrician and knowing like what are the things I need to be watching for, like what, you know, mainly growth, development, how's the baby doing, and having your pediatrician support you with that can be really helpful for a lot of moms.
And if you go to a practitioner, whether it's your OBGYN or a pediatrician, and they're just like genuinely not on board with this, do you recommend changing providers? Is this something that you think people should have a really straightforward conversation and say, like, look, I genuinely need this medication. I feel very confident in this decision. I would really appreciate your support in this. How do you recommend that someone navigate that conversation, especially like I say, if they're practitioner, like I've heard of OBGYNs that are like, you know what, this is normal. And they're like, I'm 3 months postpartum and I'm still not feeling normal. I don't know if this is actually normal. Or pediatricians who might say, like, you know, you really shouldn't be on those medications because it could harm your baby. Yet that mom knows in her heart, like, this is the right decision for me and my family at this time.
I think finding a pediatrician who will help support you and who will also help educate you is really important. And that might be finding a second opinion, or it might be asking your pediatrician to consult with an expert. There's, so many programs now out there where experts in especially perinatal mental health are very accessible to other clinicians. And there's a lot of, like consultation lines that people can call in their state or even internationally to get more information on, whether or not their patient should be taking those medications.
That's a really good idea. I often forget about, I'm always talking about collaborative care, and it's mainly between you and your provider. And I always forget about the collaboration that providers can do with one another to have this like really cohesive team approach to support families. That's a great idea. Now, how soon after starting a medication should we be able to tell a difference? Are we talking like the next day? Are we talking 14 days? Do we need to wait 6 weeks? Because if you're really in the throes of it, 6 weeks feels like, holy cow,
Mhm.
we're far out from that.
Yeah. It depends on the medication. And unfortunately, for most medications, when we're talking about the brain, we usually need about 4 to 6 weeks to
Okay.
see a good effect. But for postpartum depression, there are newer medications coming out that can work much quicker. And those are options, especially like maybe in our more severe cases where somebody is having suicidal thoughts or there are a lot of safety concerns. It may be worth trying one of those new medications to see if that helps things quicker.
Are you referring to something like Zulresso that is an IV? You know, you go in for a couple of days and get an IV treatment and it should be quicker? Question mark.
Yes. So there was one called Zelresso, or the chemical name is brexanolone, but I don't think that one is available any longer. And now they
Oh,
make a pill form
okay.
called zuranolone. And that one, I think you can just get through a specialty pharmacy and you take it at home. But yes, it can work much quicker. And depending on if insurance will cover it or not for some people, it, can be very affordable.
Now, does that cut into our options a bit, whether your insurance is going to? Yes, it does. Okay, so not all medications are going to be covered by all insurances. And then what? We as the consumer are kind of stuck with the decision of like, do I want to take a medication that's covered versus maybe this one is better for me and it's not covered, so the whole thing would be out of pocket?
Yes, which
Ugh,
is so frustrating.
so
But
crummy.
a lot of times your doctor can also help advocate for you and do appeals for what the insurance company has said. It doesn't always work, but it is kind of an extra step that can be done sometimes and for some people ends up helping.
That's really nice to know. Okay, and then I guess my next question is if we get on a medication, we've waited the 4 to 6 weeks, it is still not working. What are our next steps? My brain goes to should we play around with the dose and see if maybe we're dosing you appropriately? Or should we try a different medication? Are both of those viable options? And are there other options to think about?
So, if you're breastfeeding, you have to remember that anything you're taking, baby's getting exposed to. And so, when somebody is breastfeeding, we're going to be much more conservative with how many medications we're trying. And in those cases, we definitely want to increase the dose because a lot of times the dose that we start out with is the starting dose, and it's not necessarily going to be the effective dose for everyone. And that depends on just your body and genetics and how you metabolize medication. So, for some people, they just need much higher doses of the medications for them to be effective, and it won't work at the lower doses. It doesn't necessarily mean that medication's wrong for them, it just means that they need a different dose.
And is that weight based, height based, based on previous mental health or how long you have maybe had a diagnosis? What's that based off of? Or it's literally just like metabolism, maybe.
Yeah, so once you kind of get into adulthood, it's not as much weight based anymore for most medications. It's more based on your specific liver enzymes or your kidneys and how those are functioning and how they're metabolizing the medication.
Got it. Okay, very interesting to know. I want to back up a little bit to pregnancy because something dropped into my head that I didn't ask. We know that it goes through breast milk. What about the blood-brain barrier and getting into the placenta? So if we're taking medications in pregnancy, is that also getting to our baby?
Yes. So what we generally see is that the amount that's in baby is similar to what's in mom. And so actually with breastfeeding, babies usually getting exposed to less of the medication than they were during the pregnancy. But in the pregnancy with baby being exposed to the medication, that's why we want to kind of look at these different risks that can come up and seeing is this, because of the medication? Is this because of the mental illness? What are kind of the real risks going on with that medication?
Mm-hmm. And for people who, we talked about in the beginning, feel very strongly about this not being a lifelong thing, and they reach a point where they say, okay, I'm good. I'm feeling much better. Maybe we're through that first year postpartum. Maybe I just have reached a place in my therapy, my talk therapy, and where we are in our lifestyle and the age of my child, how far out postpartum I am. I'm finally to a stable place, and I'd like to talk about coming off the medication. Talk us through what that could look like.
So, in general, with these medications, you want to be on them for about 9 months to a year of things feeling back to normal.
Okay.
So, it doesn't necessarily, the clock doesn't start when you start the medication. It's okay, once you're feeling back to normal, that starts the clock of being on the medication for about 9 months to a year. And this is based on research showing that 9 months to a year seems to be what our brain needs for it to sustain the effects of the medication once we come off of it. And then coming off of it, you want to slowly come off of it. So you don't want to rip it away. You want to slowly decrease the dose and over time come off the medication. And that also improves the likelihood that you're going to keep the effects of the medication even after you've stopped taking it. And for a lot of people, they can then not need the medication for the rest of their life. For people who have had more episodes of mental illness or who have had more chronic mental illness, that can be more difficult. And it's very likely that it will return at some point. But that's kind of a discussion to have with your doctor of, being on the lookout for those things and whether or not to continue the medication indefinitely or to try getting off of it at times.
And it's so individualized, right? It's like it's truly individualized to your health and your goals and your lifestyle and the support that you have and the access that you have and even your baby that you have. Like the temperament of your
Yeah.
baby plays so much into this, right? Okay, I have a question that is kind of, it's not like philosophical. I don't know what to call it. I'm a very visual thinker. So, is it that when we give our brains these medications, we are almost training our brain how to produce those chemicals on their own? And then once we taper off, our brain kind of says, "Oh, I was at a 10 and now you're only giving me 8, so I need to make two more." And then when we lower that to 6, they're like, "Oh, I need to make 6 more." And then when we lower it to 2, they're like, "Oh, I need to make 8 more." And now your brain is able to kind of take it over itself and almost like a reset for, lack of a better term. Is that kind of what we're doing?
Yeah, yeah, that's a good way of looking at it. So, a lot of these treatments, medications, but also we have other treatments like transcranial magnetic stimulation or TMS or ECT, these other treatments that can also help with mental illness. So, all of them are making brain derived neurotrophic factor or BDNF. And this is basically a protein that helps our neurons connect more to each other and form more healthy connections and to kind of, make themselves healthier in general. And so that is how these medications are helping our brain work like it's supposed to. And with I mentioned like TMS or ECT. These are other treatments specifically that have been found to be really effective for depression, where you don't have to take medication necessarily, but they're treatments focused on our brain. And so with TMS, it's using magnets to kind of stimulate different parts of our brain to create that BDNF factor. And same thing with ECT, it's creating seizures in our brain, which sounds scary, but it's a very, like you're asleep during the procedure and it's a very calm procedure. But that creates these seizures and then also create that protein to be formed to help our brain re-nourish itself.
That is so fascinating. Now, a little bit of a different tune here, but EMDR therapy is more trauma related. But do we find that there's success with that in postpartum anxiety and depression?
So with EMDR, I don't think it's been studied to my knowledge specifically with postpartum depression and anxiety. It has been studied with like birth trauma, post birth trauma, PTSD,
Mm-hmm.
and it has been effective for that. But there are other therapies that have been studied specifically with postpartum depression that do have evidence for being effective, such as cognitive behavioral therapy or interpersonal family therapy.
Very cool. In addition to medication, or you could do these things individually.
So, again, depending on the severity of the mental illness, you can do them by themselves without medication. In general, therapies and medication are kind of working on different parts of our brain to help them function back to normal again. And so, for a lot of people, if they're doing both, we see better results with that. So, they're going to get better faster. They're going to get those results are going to be more sustained when they want to come off of either treatment.
That makes sense. I mean, anytime you hit something in a multifactorial way, you can pretty much expect better results. That makes so much
Yeah.
sense. Okay, my last question is one that really fires me up because I hate this rhetoric so much. But it's the bounce back culture, right? It is the mom should be doing it all. You should be able to keep your house up and get skinny again and breastfeed your baby for 17 years and never have a baby that cries and they should be sleeping through the night by 24 hours old. This is, in my opinion, so harmful and also so fake. None of those things that I just mentioned are real, first of all. They're not real, which means they're not achievable because how are you going to get to something that's not even real? Do you think that the rise in social media and the rise in essentially this fakeness and the rhetoric of like bouncing back quickly, being the perfect mom, having it all together, always having a clean house has hurt women's mental health? And do we see data wise any correlation with the rise in social media and the rise in maternal mental health?
I don't know that that's been studied, but we have seen both of those things over time, right? As time has gone on, we've seen rise in social media and we've seen rise in mental health cases around, you know, maternal mental health. But I don't know that we can say they cause each other. But I do think, in my opinion, that looking on social media and seeing these fake pictures or depictions of what somebody's life is very difficult on us and makes us think that we're not good enough, and it plays into that those lies that the disorder's already telling us of you're not good enough or you're a failure or you're not a good mom. And so I think being really careful with what you're consuming on social media around that time is important. And if you notice you're starting to feel a certain way every time you see a particular person, maybe take a break from that person around this time, or, you know, trying to make sure that you're protecting how you're viewing yourself and viewing what you're going through, because odds are it's not real. And I think it's really helpful to follow accounts where they are keeping it real, or they're kind of making fun of the struggles that we go through as mom and making, lightheartedness of it, because that also makes you feel like, okay, I'm not the only one suffering with this thing or struggling with, being a mom.
I love that so much. I will tell you guys a quick little anecdotal story is about a year and a half ago, I hired a business coach and I was really attracted to them online and I thought this is going to be great. And in our very first meeting, she tells me, you ought to wear makeup when you get online. I think people would really respect you more. And I thought, what the hell is this? Why would I like put on makeup to get online? And she said, I just think that it would help you be more of like an authority figure. And I was like, I am not looking to be an authority figure in people's lives if what they're looking for is a makeup face. I am looking to be that person that they can come to say, like, what's the evidence say about this? What kind of questions should I be asking my doctor? I'm feeling scared about this. Can you help me find resources? I don't feel heard in my clinical appointments. How can I navigate that? I am not looking for people to come to me and be like, wow, she looks really put together. Like, I'm going to listen to her. That is not what I'm looking for. So, needless to say, we did not ever meet again. I did not hire that person. That was just I mean, my mouth dropped, you guys. And so I share that story to say just because you follow somebody, you can hit that unfollow button. Just because they used to serve you or you thought it would be a good account to follow, you thought you would be able to relate to them, don't have any hard feelings or guilt or shame or embarrassment to hit that unfollow button. If they're not serving you, why keep them around? But B, they'll always be there. So if you get to a place in your life where you are looking for their content again, you can come back to it. They will be there still making content, and you will have plenty of time to scroll and catch up with all the things that you've missed in the months and the years that you have not followed them. So just keep that in mind, you guys. Not everybody deserves a place in your life in this time. And if there's ever space to invite them back in, you totally can do that. And I think that one of the really good things that we have to recognize about our own control in our own life is that we do have control over who gets access to us and who doesn't, and who we let in our circles. Now, of course, within reason, sometimes you can't always like kick your mother-in-law out of your life. I totally respect that. I understand that. But the people who you do get to choose, make sure that they're people who lift you up and they support you and they validate you and they see you for your real self, and you don't feel like you have to be fake or put on a front or hurry up and clean your house before they come over. They're going to come over and they're going to help you clean your house, or they come over and say, "Sit down. I like genuinely came over to talk to you. I cannot care less about those dishes in your sink." Those are the people that you want to surround yourself, especially if you are in a walk of life right now where maybe your mental health is not the best. I just wanted to like kind of put that out there. Like, don't, if someone's telling you to put on makeup, ditch them. Literally. I mean, I was like, "Oh my God, how do I get off this call? I cannot spend 90 minutes with this lady." That's how she opened. Oh no. We're, we're so unaligned. This is not good. I have to get out of this call. So, oh my gosh, this was such a good conversation. I'm so appreciative for you. Is there anything that we didn't cover in terms of postpartum anxiety, depression, mental health in pregnancy, postpartum, motherhood, medication, starting it, weaning it, that you think that people should know? Or do you think we kind of covered everything?
I think we pretty much covered the big pointers.
Yeah.
We did a lot today.
Nice. Cool. Okay. I love
Yeah.
that. If people had more questions, they wanted to learn from you, they wanted to connect with you, tell us how they can do that.
Yes, I am on social media. So on Instagram at the.reproductive.psychiatrist. I'm also on TikTok, but I'm not as great about getting on that one, but it's the.repro.psych. And then I have a website, KristinLasseterMD.com.
I love it. You guys, one of the things that drew me to Dr. Kristen was her information online about specific medication. So, if you're on a medication or you are thinking about being on a medication, her Instagram is filled with so much good data-backed information that not only will it give you a lot of information that you can use yourself, but it will equip you with questions that you can go in and ask your provider, and you'll be able to open up this conversation about where you are in life and what you're feeling and whether it's normal or not, and talking about different options that may help you have an easier time in whatever space you are in currently. And you know me, I just always want to really lay it out very bluntly. There's absolutely no shame in taking medications. I respect if that's not for you, but I don't want you to be intentionally avoiding medications because you think other people are going to judge you. Kind of goes back to like, if those people judge you, or do they really deserve to have access to you? In my opinion, no, they don't. Remove those people from your life. Or don't share that with them. Not everybody is entitled
Yes.
to know your health history or what you're doing to keep yourself safe or sane, or you need to make decisions that are best for you and your baby and your family. And to be honest, it's nobody else's business. And know that I support you in whatever choice you make. I trust you to make the best decision for you and your body and your family. And that's why I hold these conversations. I love asking the hard questions. I love asking the embarrassing questions. I love asking the questions that are in all of our minds, but so many of us don't want to ask. I will ask them, you guys, and then I'll share that information with you, and you can do what you will with that information. All right, you guys, I'll see you in the next episode. Thanks so much for being here. I know this is a topic of conversation that is on a lot of our minds, but so many of us are a little scared to have, and I'm glad we were able to share this space today. Be sure to follow Dr. Lasseter on social media, and you can find me at Tranquility by HeHe and at the.birth.lounge. Until next time, head to your app store and download the Birth Lounge app for evidence-based childbirth education and data-driven postpartum support delivered straight to your phone. Bye.
Thank you so much for tuning in today. I love hanging out with you, and it is an honor to be your go-to gal when it comes to preparing for your baby. If you've enjoyed today's episode, please leave a 5-star review and tell others why they should be listening to the Birth Lounge podcast too. You deserve to have a birth that you love with a provider that values your autonomy and respects informed consent without all the trauma that you so commonly hear about on social media. New episodes air every Wednesday and Friday. Hit that follow button so you never miss an episode. I'm HeHe, and this is the Birth Lounge Podcast.